Dry eye syndrome. Dry eye syndrome is a pervasive issue in society. With appropriate evaluation and treatment, people can be quite comfortable. Dry eye syndrome is one of the most common problems affecting the general population and can cause problems that range in severity from mildly irritating to debilitating. Dry eye syndrome is a general term that describes the state of the front of the eye in response to a breakdown in the natural layer of tears that coats the front of the eye, called the tear film. Normally, this layer of tears is a stable, homogeneous layer that not only provides the cornea and conjunctiva a healthy buffer from damage were it constantly exposed to the air, but this interface between the tear film and the air is also responsible for a significant amount of the focusing power of the eye. When the tear film becomes unhealthy, it breaks down in different places on the cornea and conjunctiva, leading not only to symptoms of irritation, but also to unstable and intermittently changing vision. While there are numerous different symptoms one can experience, prominent amongst these symptoms is tearing. Naturally, a patient may wonder why their eye can be dry despite producing plenty of tears. This is because the unhealthy tear film and the irritation that comes from it stimulates the brain to produce a wave or reflex of tears to help counteract the irritation. However, this reflex tearing is simply insufficient to correct the overall problem. For this reason, dry eye syndrome could more appropriately be termed tear film dysfunction. Dry eye is a common ocular condition and a major reason for visits to ophthalmologists. Its prevalence varies widely among epidemiological studies depending on how the disease is defined and diagnosed, and which population is surveyed. Moreover, the definition of dry eye is still under continual revision, and the lack of a single diagnostic tool challenges ophthalmologists worldwide. Infrequent blinking, associated with staring at computer or video screens, which is becoming a more frequent contributor, and Parkinson's. Sometimes there are obvious signs of dry eye syndrome/tear film dysfunction that acquaintances or even your primary care doctor may notice that may prompt a patient to seek treatment. However, most people with dry eye syndrome/tear film dysfunction have signs of it which are not even obvious on a general, screening eye exam. Depending on the particular constellation of signs, symptoms, history and comorbidities, tests ranging from Schirmer's tear test to blood tests to check for systemic disease may be warranted. An individual with dry eye syndrome/tear film dysfunction may, in fact, have more than one cause acting simultaneously to produce the symptoms. This is actually the case for many persons who suffer from dry eye syndrome. For this reason, many persons who undergo casual evaluations and/or treatment attempts of dry eye syndrome without investigating for and treating all the possible causes can end up becoming frustrated, have persistent symptoms that can worsen, and may jump from doctor to seek relief. Sensory denervation may cause dry eye by reducing the afferent signaling of tear production, reducing the blink rate, and by altering trigeminal nerve influences on ocular epithelial health. Depending on the causes, there are numerous treatments for dry eye syndrome, tear film dysfunction, but the more common treatment modalities include artificial tears, preferably ones without a redness reliever component in them. Longer-acting agents such as artificial tear gel and ointments and Lacrosert, hydroxypropyl cellulose ophthalmic insert. Tear-conserving interventions such as punctal plugs or nighttime masks/goggles. Warm compresses. Eyelash and eyelid scrubs. Prescription medicines such as Restasis, Cyclosporin 0. Topical ophthalmic steroids are helpful in controlling the inflammatory aspect of the disease in short bursts.